Good morning. I'm Muriel Bowser, the Mayor of Washington, D.C. I'm here today to provide the district's update on our response to COVID-19. Today, I'm going to share some general updates and then provide an update around our public safety agencies. This morning, we reported 134 new cases of COVID in the district, bringing our total number of cases to 2,927. Sadly, we also announced 9 deaths. This weekend, we received some sad news that a member of our DCPS community, Dr. Makumbi, who was the school psychologist at Houston Elementary School, passed away due to COVID-19. He will be missed dearly by his students, families, and coworkers, and all of the lives that he touched. We share our condolences with his family. I also want to share my deepest condolences with Councilmember Trayon White, who announced this weekend that his grandmother passed away. Ms. Norman served our community at St. Elizabeth since 1980, and I know our community shares her prayers with the council member and his family during this difficult time. I want to provide also an update on some public safety data. Last Wednesday, as part of our vulnerable populations presentation, I shared with you some information on how our modified operations at the depopulated DOC and DYRS facilities. Over the weekend, you may know that we received some information from the court in response to their DOC visits. So today we will share with you more information about that and how we continue to improve operations at the jail. I want to be clear that we're all on the same page about what we want at our facilities. We want our residents safe and healthy, and we want our staff safe and healthy. So here's the most recent information about the DOC and DYRS facilities. This data is, of course, updated on a daily basis. So we're sharing with you the number of residents and who have tested positive and recovered any loss of life reported from our facilities, including DYRS. So this weekend we received the court inspector's report, and based on their visit to the jail the weekend of April 11th, just over a week ago. This weekend we also got some feedback from the CDC on our DOC policies. So prior to receiving the report, our team at the Department of Corrections was already very focused on making improvements to operations and policies to this unprecedented challenge. It has required us to modify, of course, our operations quickly across DC government, but especially congregate settings where we serve the most vulnerable. And so the DOC has been working diligently since March to modify and continuously improve those operations. Some fixes from the report could be made more quickly than others. For example, around getting PPE distributed, which we've reported on a number of times here. And other actions are ongoing, like making sure residents are properly social distancing when they are out of their units. And we remain committed to those operations and accountability. Some other enhancements include, I'm going to go back, calling in experts to provide updated training on the proper use of PPE by staff and by residents. Daily in-person showers for those who are in isolation because of COVID infection. At the acquisition of more tablets, more entertainment and education so that there's less crowding around televisions, improvements in providing free telephonic access to counsel, and calling in experts for hygiene advice and deep cleaning at the facility. And so those were some of the recommendations outlined in the report. Right now, our DOC and our Emergency Operations Center are working together to deploy medical volunteers to our DOC facilities to assist with the monitoring staff and residents for symptoms of COVID-19. Today, I'm also appointing the DYRS Director, Clinton Lacey, to lead an effort for the rest of the public health emergency to continually monitor and improve our response to COVID at DOC facilities, as well as at St. Elizabeth's Hospital. As my executive lead on these issues, Director Lacey will be supported by health and operational experts from DYRS, DOC, and DBH. For the DC jail specifically, the court inspector's report, as well as the CDC's feedback, will serve as a foundation for Director Lacey and this team to help us oversee the implementation of recommendations and all other best practice information that we get around infection control at DOC and at St. Elizabeth's. Now I want to share some updates on how our Metropolitan Police Department continues to support the COVID-19 response. Here you can see our most recent information at MPD as well as fire and EMS. You'll note there that MPD has had 82 positive cases with 21 reported recovered, and fire and EMS have had 76 reported cases with 37 recovered. So we're certainly happy to also note that and the chief can talk about this, the numbers of people in quarantine related to these cases is also down. We, of course, continue to be grateful for the work of our first responders, and I've said it before, but we're certainly reminded now of the sacrifices they make and the sacrifices their families make as well. In another bit of news, starting today, our team at MPD is actually taking on an additional responsibility. Last month, the city's sole commercial federal firearms licensee abruptly ceased accepting any new business. And so that we wouldn't run into any constitutional issues or open ourselves up to meddling in our gun laws from outside groups, MPD and the deputy mayor immediately started working on alternatives. The solution that we came up with was to delegate to MPD the authority to operate as the district's federal firearms licensee while there is no other commercial alternative. And once there is a viable commercial alternative license to operate in DC, MPD will no longer need to serve this role. So I will sign that mayor's order today. MPD, of course, is supporting our community by going out and making sure people and businesses are practicing social distancing. And I've already said that this is not an issue we're going to police ourselves out of. And we are counting on DC residents and businesses to do their part. And MPD is certainly there to help make sure that they are. But our officers are going out to tell people to disperse, report possible business violations to DCRA and ABRA, and respond to normal calls for service. And while we haven't seen any spike in hate crimes related to COVID-19, MPD is also working with our Office of Asian and Pacific Islander Affairs and our Office of Human Rights to do extensive community outreach around making sure residents are being responded to and feel safe from hate or discrimination. We've fielded a number of questions about how the public health emergency has impacted crime rates in the district. So I want to just mention a couple of things, and the chief, of course, will explain more. What we've seen is that property crimes have decreased by nearly 40% over the last 30 days. We're almost at exactly the 30-day point, and violent crimes are down about 3%. Unfortunately, gun crimes are mostly unchanged, and while we can continue to see members of our community use firearms to settle disputes. Even through this emergency, the work continues to get illegal guns off the streets of Washington, D.C. We have also been very concerned about the stay-at-home order and any impact that it has on domestic violence, and any impact that it has on reports for children who are unsafe at home. While we have not noticed any significant or sustained trends in the district around domestic violence, we want to continue to be mindful about people who are not safe at home. And so we're going to want to provide information here about people who need help and how they can reach out to us. Victims can still file for temporary protection orders with the D.C. courts. So let me make that very clear. Victims in need of help should contact the D.C. Victim Hotline at 1-844-4HELP-DC by phone or text 24/7. Services include crisis housing, counseling and legal advocacy, and medical forensic care. And our 911 call center always wants me to emphasize this. If you cannot make a call, you can text 911 for one of our operators who is trained to assist you. I also, Michelle Garcia, who leads our Office of Victim Services and Justice Grants, and also the Office of Human Rights, has joined us today and can also add to those comments. I also want neighbors and friends and family who may be aware of a child in an unsafe situation at home to know that they can report incidents of child abuse and neglect to us by calling 202-671-SAFE. That's SAFE, 202-671-SAFE. And we'll finish today and then turn to your questions by reminding all DC residents of the testing sites across the District of Columbia. You can call if you're not connected to a doctor or a medical provider, medical home, you can call our UMC hotline at 1-855-363-0333, and you will be referred appropriately. So with that, let me first turn to Chief Newsham to speak on behalf of MPD.
Okay, thank you, Madam Mayor, and thank you for all your efforts during this public health emergency. So we have had, as the Mayor indicated, we've had 82 positive tests at MPD. We've had 293 negative tests with 2 members currently hospitalized. One of them is in critical condition. The other one, I got a report from the family this morning, and he's doing better. So we're all thinking about those 2 members who have been hospitalized. We have 22 sworn members who have returned, so they've fully recovered after testing positive. We implemented a number of things to ensure social distancing amongst our members and the public. Initially, our Office of Unified Communication will screen callers by asking if anyone in the household has tested positive. In that way, they can warn officers before they respond to a call for service to appropriately take measures to protect themselves, don their PPE if necessary. We've been conducting outdoor roll calls. We've asked the public to conduct interviews outside whenever possible. We've had more calls that are taken by our telephone reporting unit. We've increased the types of calls that are transferred to telephone reporting to ensure safe distancing. We've increased the number of cases that are eligible for citation release. We're medically screening prisoners before they enter our facilities. We're screening all of our employees. We're having our police officers wear masks consistent with the updated mayor's order. As you know, with the assistance of the U.S. Park Police and the National Park Service, 3 of our parks we have closed to vehicular traffic in the city, 3 of our larger parks, Rock Creek, Fort DuPont, and Anacostia. The Fort DuPont Park is still opened to community gardening, and we will let vehicles through for that. The Park Police will. Other parks where we've increased staffing in areas in the city, because these are areas that have come to our attention where people were not practicing social distancing, is Shepherd Park, Lincoln Park, Meridian Hill Park, and down at the wharf. The officers are doing everything they possibly can to get voluntary compliance with the mayor's order. We will make arrests if necessary. Thankfully, we have not had to make any arrests to this point. So far, we've had 23 businesses that we've had to report to DCRA and ABRA for various violations. We haven't had any of those violations in the last couple of days, so most of our businesses are coming into compliance. So that's what we have at MPD so far.
Okay. Michelle?
Thank you, Mayor. In many areas across the country and globally, we have seen an increase in calls for domestic violence. Thankfully, we've not seen a similar significant increase in requests for services or reports to MPD thus far in the district, but we are constantly monitoring and working to be prepared if and when that does happen. What we can say is while we haven't seen an increase in requests for services, we are seeing those requests taking a little bit longer, only because we know with limitations around transportation and ability to move, safety planning may take a little more time. We do encourage victims who are in need of assistance from MPD to use text to 911, and also for any who are trying to seek information on emergency or transitional housing, mental health support, medical forensic care, to please call the DC Victim Hotline, as the mayor said, 1-844-4HELP-DC. It's available by phone or text 24/7, or you can also reach the hotline online via chat at dcvictim.org. All of our domestic violence service providers are available to provide those necessary and life-saving services, and so we encourage victims in the district to please reach out for assistance.
Thank you. Kevin, do you have anything else to add?
Nothing.
Okay, thank you. Any questions? Yes.
At the DC jail, the court reporters said that a big reason that they weren't enforcing social distancing was because of a lack of staffing. So how, given that, how will you support the DC jail enforcing social distancing staffing initiatives?
Kevin?
Staffing is a challenge to the DC jail. They have more than a quarter of their workforce that is not coming to work because of quarantine or sickness. And that puts a pressure to be able to safely oversee the residents there. It puts pressure on the jail to be much more efficient and consistent with their operation. What they're doing now for both, primarily for reasons of social distancing, but it also has a benefit when staffing is down, is letting about 5 residents out of their cells at any one time and rotating that throughout the day. So that limits the amount of time individuals have out of their cell, which helps with social distancing. It also allows for DOC to be able to more safely oversee the application of those distancing policies. And that we hope, like FEMS and like MPD, who has seen the number of individuals out come down as PPE has been distributed and as individuals come off quarantine, we hope to see that at DOC as well.
Yes, Sam?
Ms. Mayor, the order talked about a sanitarian. Is that the role Director Lacey is playing? I mean, this basically is somebody that oversees the cleaning of the jail.
No. Director Lacey's job is to, well, in addition to being an excellent director of DYRS, I have asked him, because of his long experience in corrections, working with DYRS, but also working with the inspector team that was at DC Jail, because they have most recently been the monitor for DYRS, and they're coming out of being the monitor at DYRS. So we're very pleased at that. But we also know that the infection control practices that may be successful in one congregate setting like the jail may also inform another congregate setting that we're concerned about at St. Elizabeth's. So we expect Director Lacey to be my executive lead, working with operations, the EOC, and the directors at St. Elizabeth's and the jail to make sure we're implementing not only what we saw with this report that I outlined some of the things. Can we go back to the outline of the DOC some of the things that you can see here, we've talked about in this setting before, so a lot of them are already in progress, but some of it relates to enhanced sanitation, other to strategies to get people to be apart, others about training for staff and for inmates. So we think those are all things that we're either going to start, but in most cases, we're going to speed up.
And the position of sanitarian, would it be something that he will decide?
We'll fit, and actually, I don't know if we even have we may have a sanitarian that works for DC government. If that's somebody that we have to go out and hire, then that will work through that work group, yes.
Do you have one already? You were not.
Do you know if we have one?
We have to see if somewhere else in DC government we have the expertise on hand, and if we don't, it's something Director Lacey with Director Booth will make sure we do. And I think the reference there is largely to recognize that the level of comprehensive cleaning, the level of technical expertise that will go into preventing the spread of COVID-19 at a detention facility is unique, and to make sure that we have the expertise on hand to demonstrate and show how practices need to be different than perhaps in a different setting to be able to safely protect people.
And I only paused there because early on in our response, our Department of General Services really took a hard look at all of our DC government buildings to make sure that they were stepping up the schedules of cleaning, what types of cleaning, and announcing via some sign-in sheet how those schedules were going. So we have been very mindful, and our DGS team usually handles all of that for us. So we will make sure if we don't have the capacity in-house that we get it.
So it was filed as like a temporary restraining order. So I guess that's the implication you give here is that this is going to be done quickly. Is that the intention of the government?
Well, as I mentioned, Sam, we believe a lot of these things are already underway. I have appointed, I think, a person who can make sure and has some of this experience of working with the monitor to get things that aren't done. Training, I think, was called out about the use of PPE among the staff, and so all of those things we think can advance. Yes.
Mayor, first off, have you read the judge's 30-page decision on the jail? And secondly, your reaction to a quote from her that says that the corrections officials have shown a deliberate indifference to inmates' health by failing to take comprehensive, timely, and proper steps to stem the spread of the virus.
Well, we would disagree with any conclusion that said we weren't working very hard to save lives in Washington, D.C.
Have you read her report?
I have not yet. I have been fully briefed on it.
And you have confidence in the head of DOC at this point?
Yes.
And you feel like there's been no failures there?
I've talked to you about the things at length that we have in place, and I think that we can see, and I'll turn to Kevin to fully talk about the order, but what we know is that congregate settings across the United States are trying to stop the spread of infection, and that includes DOC, that includes corrections facilities all across the United States. So if there are ways, if there's something that we think that or the court thinks that we haven't done, then we'll do it. We will take any and all information about how to keep people safe.
I'd like to ask Kevin, there's 840, I believe, inmates in quarantine at this point. What kind of a challenge is that?
It presents an extraordinary challenge for DOC and other facilities like it. What that means from a practical standpoint is that the residents of the DOC, to the extent possible, are placed in individual cells, so they're there without a cellmate, and they will spend more time in their cells than they otherwise would. One of the implications of that, and I think an unintended consequence of DOC wanting deliberately to have aggressive quarantine policies, is to make sure those residents still have access to their attorneys and they still have a way of socially interacting with the world. And I think the DOC is attempting to get those individuals tablets and other means by which there can be some social and human interaction in the context of wanting to protect those individuals from any spread of the disease, and that's a unique and complicated challenge. The one thing I would just like to add to your first question is that I did read the full brief, and my reading of that quote is that for the judge to be able to issue an order to DOC, the judge had to have certain legal thresholds met. And the phrase he uses, a legal term of art, as one of the thresholds that must be met in order for the judge to order DOC to comply with the judge's ruling. So when I read the inspector's report, which was over the weekend, I thought it was very fair, it was comprehensive, and at the heart of it, it was about pushing DOC to consistently applying policies with practice and to prove that they are. And for the judge to be able to turn that report into a court-ordered directive, that thou shalt implement these 13 areas of recommendations, the judge had to have DOC meet certain legal thresholds. And that happens to be one of them. So what I think my interpretation of that is that the judge felt, as we did, that these recommendations were sound and fair, that DOC implementing them is, at this point in time, a sufficient response to the lawsuit. And for a judge to make that action, the judge had to make sure and identify that DOC hit those thresholds for a class action lawsuit to be able to issue that order. And so at the end of that order, it was for DOC to implement the guidance given by the inspectors. And that's what they're doing, and that's what we committed to doing even before we saw those recommendations.
Yes?
For the, again, for the DC jail, another issue that the inspectors mentioned was lack of cleaning supplies and laundry services. So I was wondering if you could brief us about the procurement for that, or the process. Are you in the process of preparing that?
Yes, that's something that we are both procuring and part of what Director Lacey has experience with, which is not only hitting that threshold, but consistently doing it over the course of time and sustaining it. So it was both the availability of supplies and making sure that they stay available over the course of the weeks and months when we're in this very unique setting. And that's one of the items that was initiated prior to the issuance of the report, because we knew that cleaning supplies, PPE, we must always be procuring.
For Dr. Nesbitt, if I could follow up on our reporting over the weekend about the quarantine center. One, do you consider these quarantine centers medical facilities?
I'm sorry, quarantine center? I'm not clear.
Where you're quarantining 280 homeless individuals. So do you consider these facilities medical facilities? And do you believe that they should be disposing of used PPE, soiled linens and such as red bag waste, or just out with the normal trash as they are doing? And then also about the protocol of them bringing patients from inside out onto the sidewalk, performing some kind of checkups on them and taking them back inside.
I can't speak to exactly what you are referring to. We have identified settings where we are depopulating our shelters to keep people safe, our emergency low barrier shelters, and have identified, consistent with CDC guidelines, that the use of hotels to provide people private rooms where they have access to bathrooms that they do not have to share is an appropriate use of that space.
Sure, but is that a medical facility?
It is not a medical facility.
And what about the disposal of waste from there? The DC code speaks directly to the way to dispose of waste from anywhere where people are being housed with communicable diseases to keep them safe from the public. Which is exactly what this seems to be. How should used PPE and soiled linens from these quarantine centers be disposed of?
There are very specific guidelines that I could provide to you that are CDC guidelines in terms of how waste or PPE can be disposed of for COVID positive individuals.
And so if that protocol should that protocol be followed at these quarantine
It's the same that should be used for commercial settings and for households, so I will provide that to you.
Okay, and what about screening patients out on the sidewalk?
I have given people specific responses and guidances in terms of, I'm not sure what screening you're referring to, but people can have specimens collected in outdoor settings in a manner that does not pose a threat to the general public.
And then
So I'm not sure what you are describing as screening. You can safely take someone's temperature outside and that
why
be
would-
done in a
why
safe
would
way.
Why would medical personnel in full PPE, head to toe, bring a patient from inside the quarantine center out on the sidewalk, take their vitals, and then take them back inside?
Mark, it sounds like you're talking about a specific incident, so let's do some looking in.
Dr. Nesbitt, what happens to bodies after they die? If somebody, if there's 105 people who have died of COVID in DC, are they released back to the family for burial and services? Are their bodies quarantined? Can you tell us what happens there?
So, body, when you say as a body released to the family, bodies in the District of Columbia are released for burial to funeral homes.
Okay, so, and that's just normal. You're not, are you housing COVID fatality bodies anywhere? We've seen images from other states and other jurisdictions of refrigerator trucks and whatnot that are housing bodies that have died.
Let me step back. In our emergency operations center, the office of the chief medical examiner is part, of course, Mark, of our emergency response and is involved in every aspect of our planning. Dr. Mitchell, a couple of weeks ago, convened calls with the funeral homes in the area to brief them on everything that he knew. There was a request, I think, for PPE that we're supporting the funeral directors with, and we continue to do that. We believe that our funeral directors are able and continue to be able to serve DC families. The medical examiner will have a contingency, of course, in the event that they are not.
And we have also provided guidance.
And yes, early on, the Department of Health provided guidance to funeral directors on proper handling.
So does the city have refrigerator trucks that are storing bodies right now?
We're not storing any bodies right now, but we would have the capacity if it came to pass. Yes, Sam.
Mayor, I understand the city is preparing the convention center to handle patients. Could you tell us about that?
We have, and as I mentioned, I think a couple of days ago, that's like our insurance policy. Our focus and the point of our surge planning has been to add the additional beds that we need in hospital settings. I'm very pleased that our hospital system as a whole has been able to add what we think are the number of beds to handle our surge. And then the outside number that we would need would be built at the convention center. We have the ability to phase the construction at the convention center based on the needs that we see on the ground with how this virus is performing in the city and the hospital's ability to take it. It is being built as a non or lower acuity center so that the patients needing the most care, ventilators, ICU would still be at area hospitals, and those folks presenting for other issues, as continue to happen every single day, would be treated at the convention center.
So how is it working? Are the hospitals approaching capacity? Will this place ever be needed, you think?
We hope it won't ever be needed, but it will be there in the event that we hit a peak that exceeds what's available in our hospitals. And I don't have the numbers off the top of my head, but I'm going to turn to Dr. Nesbitt, who's been working very closely with our operations teams to talk about that surge.
Yeah, so our hospitals now are still operating about 70, 75%, 60, like close to 70, 75% capacity. So we're not yet at a point where they have entered into medical surge, where we would be needing to step down patients into the convention center, or we are getting to a place where we are exceeding our ICU capacity or any of those things. We continue to follow and monitor those trends to look for when we would need to move into that capacity as the mayor has described.
Doctor, I forgot the sudden date. Is it July still, late June, July?
Yeah, so we still are looking, anticipating that we would hit our peak still in June. The middle of June is still where we would anticipate hitting our peak. As the mayor discussed last week, we are trending below where we expect it to be in terms of the total number of cases, the number of hospitalizations, but we still estimate that that peak, when it occurs, will be during that same period of time.
Chief Dusham, can you tell me how out on the street your officers are told to, when they're engaging with the public, are they to be wearing PPEs? And how concerned are you that in engaging with the public, where they're engaging with people that are not social distancing or wearing PPEs themselves, that they're putting themselves at risk?
Well, we're very concerned because we don't want the virus to spread at all. We don't want it to spread amongst the community. We certainly don't want it to spread amongst our police officers and impact our police services. Thankfully, that hasn't happened yet. In fact, our numbers of people that are out due to quarantine have actually been going down in recent days pretty dramatically. We were up over 300 at one point. Now we're below 200. We're at about 185. So the direction that we've given our officers is consistent with the direction in the mayor's order. People have to keep in mind that police officers do come across exigent circumstances where they don't have an opportunity to don their personal protective equipment. And we have to balance the constant wearing of the gear, the protective gear, with the resource and the availability of the resource. Right now, we've been very fortunate to have plenty of PPE, plenty of masks to provide to our officers, and we want that to remain. We want that to continue, so we don't want them unnecessarily putting on protective equipment.
Well, what is the order right now for them if they're just out patrolling in their cars? Do they have to wear a mask?
Not when they're out patrolling. If they're going to come into contact within 6 feet of somebody, they should be putting on the mask. If they go into any of the locations like the grocery stores, they should be putting on the masks. I don't know if you know this or not, but the World Central Kitchen has actually been providing meals to our chef Jose Andreas has been providing meals to all first responders, including our police officers. And one of the things that does, in addition to be unbelievably gracious, is that it prevents our officers from having to go in and out of some of the establishments where they might have to put on their personal protective equipment.
Okay, thank you, Dahlia. Go ahead. Dahlia?
Hello, good morning.
Good
This
morning.
is Delia from Channel 9.
Delia,
I have four
thank you.
questions, two for the new reporter in town, I guess. I have four questions, two for the mayor, two for the chief. I'll start with you, Madam Mayor, about the hotline that you established last week. We understand that some of those calls are being funneled to some area nonprofits, including DC Mutual Aid. The folks there are certainly happy to help the city out, but they're volunteers. They've been inundated with additional calls and requests. So could you explain why that was happening? And do you, as a result, plan to give these nonprofits additional resources to handle the additional calls?
Well, I would like to know which nonprofits you're talking about.
DC Mutual Aid was
But
one
what
in
is that?
particular.
What are those nonprofits?
DC Mutual Aid, Capital Area Food Bank. DC Mutual Aid, certainly, I'm sure you're aware, is a group of basically neighborhood volunteers who are working to feed their neighbors.
Okay,
And
so let me explain, and
we're here-
I went over this on Friday, but I'll go over it again, is that we set up the hotline, and it's the district's hotline. It's to free people who live in the district who need help. Our hotline is focused on people who are quarantined or homebound. If we got calls to that hotline who didn't fit those two categories of being quarantined or homebound, we looked at all of the nonprofits doing work in that space or in a specific geographic area, and we referred people, as we would in any other case, to those nonprofits who are doing work in that space. So if they have presented themselves as helping people in need or helping the hungry, then they would have gotten a referral. If they're not doing that, and they're not helping people in need or helping, then we need to take them down from our referral list.
Okay, so the hotline,
Come again? Uh-oh. Delia, did we lose you?
no, I'm still here.
Okay,
I
go
got
ahead.
A message, but I think I'm still here.
Okay.
Okay, so you cleared that up. I appreciate that. The second set of questions is two quick questions for the chief in regards to your COVID cases amongst your officers. And, you know, I understand it's a very difficult time with some of your own members, fighting for their lives in the hospital at this point. But we have obtained some information in regards to the breakdown of cases amongst the districts, and it seems that 6D has a pretty incredible amount of cases compared to the rest of MPD officers. We counted 25 as of, I believe, yesterday, when the cases were at 81 total. So could you explain why that is happening and perhaps why those officers at 6D are perhaps at greater risk, and if that is affecting operations in any way?
So I don't know what numbers you're looking at to compare this to. You are correct that we have more members that are 6th District who are quarantined. And I don't know if I don't know. I think on the positives too, they might be on the higher side too. And I think I would attribute that to the fact that the virus was obviously in close proximity to the officers in that particular area. You can compare that with other districts. We have other districts that are in the range of about 30 members that are quarantined. I think that's the next closest number to the 6th District. So one of the reasons we collect that information is so we can provide additional resources over to the 6th District if we see a little bit of an increase in the number of members that are quarantined. I guess, like I said, I don't know the numbers you're looking at. It would be helpful if you could talk about that a little bit, but the numbers I think you're looking at are the number of members that are quarantined and not necessarily the number of members that have tested positive.
I'm looking at Chief?
Yes.
Go ahead, Delia.
Okay, sorry about the delay. I'm looking at an internal email that says the 87 members, 81 sworn, 6 civilian, who notified us of positive tests thus far are assigned to the below unit. And it breaks down by unit, 1st District 6, 2nd District 3, and then it goes down to 6th District 25. So according to this email that we've obtained, these are all classified as folks who notified the department that they've tested positive thus far. So wondering, are we shifting our resources because it appears that more 6D officers have tested positive, whether or not they're quarantined? Have we shifted our resources to address the issue that's happening in 6D?
Yeah, so I do look at those numbers too, but I look at for shifting resources, I look at the number of people quarantined because that's the number of people that are unavailable. And those numbers in the 6th District are a little bit up from the other districts. And so as a result of that, I have shifted resources over there.
Okay.
So what does that look like? Could you explain a little further what exactly that looks like in regards to shifting resources? Does that mean additional officers there? We know some of the unfortunate shootings that happened over the weekend happened within 6D.
Yeah,
so wondering if that
yeah,
means
we had,
additional officers.
Very fortunately, we only had 2 shooting incidents this past weekend. Unfortunately, one of those was a homicide. But with regards to shifting of resources, in addition to the folks that I have assigned to patrol, also have folks that are assigned to my Homeland Security Bureau, to my Narcotics and Special Investigations Division, and I also have the ability to utilize overtime in the event that I see a resource gap in a particular district, and I would use each and any one of those as necessary to ensure that we can provide police services to every district here in the city.
Amanda from the city.
Amanda, thank you. Go ahead.
Hi, thank you so much for taking my question. I have 2. So my first question has to do with today's data. Thank you for releasing the ward breakdown as it relates to lives lost to COVID-19. So the data was showing that, Ward 2 had the least number of reported deaths and Ward 8 had the most. And I wondered what your impression of this data was so far.
Dr. Nesbitt.
So when we release ward level data, we encourage people not to make many inferences about the data. There may be some correlation between where the cases are and where the deaths are, but we have not made any inferences to the data at this point.
Thank you. And my second question is, what's the average number of people tested per day, and what is also our testing capacity? Thank you.
So that's something that we're still trying to get a lot of clarity on. The best information that we know is related to the district's public health lab, which has a capacity of approximately 500 tests per day. There is a number of other resources that healthcare providers in the district have access to in terms of their ability to have tests done at commercial laboratories such as LabCorp and Quest. Some of them have their own clinical laboratories that have the ability to conduct tests. And then they may have acquired their own point of care instruments that allow them to conduct testing in their own private practices. Over the course of this week, we'll be doing a lot of assessments of what that capacity is to be able to better quantify that across the district, so we can really fully understand when we talk about testing capacity in the district, what that really means. But right now, it's not very well known and understood because we don't know to what extent the private providers, large health systems, and large primary care providers are using the commercial laboratories, are conducting point of care testing for current infection, what they are really tapping into. The second thing is that I think we also have a lot to fully understand when healthcare providers say that they are offering testing. Are they offering testing for current infection, or have they started to offer antibody testing that they are not fully disclosing or explaining to their patients exactly what they are testing them for? So they may be using some of these new-to-market antibody tests that test for an exposure to COVID-19 that doesn't diagnose a current infection, and are not really the tests that test you for current infection. So we're doing a lot to gather information over the next couple of days to be able to quantify what the district's overall capacity for testing is beyond what is available at the district's public health lab.
And let's also go back to slide 12, and we can leave up all of the various numbers that we're asking DC residents to call, your own providers, if you don't have a provider, how you can be connected to the UNC call line and be referred to the appropriate places. And I also want to say, just kind of 30,000-foot answer to the previous question is, we're looking for ways to do more testing. We know, and it's very clear, that to get back open, to open up DC the way we all want, when the data and our experience on the ground says that we can. How can we get to phase one? As you've heard the president say, and the White House task force say, how do we get to phase one? And we know that having the level of testing, a level of testing consistent with getting open is going to take more. So we, Dr. Nesbitt and Dr. Smith, have been focused on the point of care systems and how we get them out to our vulnerable populations over the last several days, which is adding to our testing capacity. And we will continue to learn more from the private providers about the testing that they're doing and how they're reporting that information to us, and anything more that we can do. So we will look forward to continuing to report to you on our strategies to get more tests, more supplies, and get them out consistent with how we get to phase one. Okay, let's. Okay, two more on the phone. Okay, go ahead, Washington Post.
Hi, Fennec with the Washington Post here. Can you hear me?
I can.
What are the latest hospitalization figures in D.C., including ICU and ventilator use?
One second.
Can you ask the second question while we're pulling this?
I think, is this
I have
the
it. No,
current?
I have it.
Okay.
402 inpatients, 120 in the ICU, 69 of whom are on vents.
And then you mentioned earlier that the hospitalizations are coming in below projections. Can we get some context for that? When were you originally expecting hospitals to hit their peak and enter surge?
So we expected the peaks for hospitalizations to occur in June. We were expecting to need to have 1,000 additional beds available around April 15th. But because our numbers are coming in lower than expected, that need for those additional 1,000 beds has been pushed to around the middle of May.
Okay. So it sounds like hospitalizations have been on the rise, but not rising as much as the city had feared.
Not as early. Yes.
Okay. And then what kind of trends has the city been seeing in the latest batches of people who've been getting infected? Like, do you have any reason to believe that it's mostly concentrated among first responders and essential workers, or if more of the new cases are coming out of impoverished parts of the city, or are you seeing anything there?
I would answer this question, and we spent a lot of time talking last week about our vulnerable populations, and we continue to be very concerned about vulnerable populations, people who are living in long-term care facilities. I always get this, our developmentally disabled population, homeless population, and other congregate settings like DC Jail and St. Elizabeth's. So that is the trend that we and everyone around the country is very concerned about.
And then Alex from CNN.
Alex, are you there?
Mayor, thanks so much for taking my question.
Yep.
I'm here. Can you hear me?
I can.
This is for either you or Dr. Nesbitt. You had just said that you believe that the peak is still going to be in mid-June, but you had said last week that you expected it to be mid to late May. I know it's a shifting target, so if it has indeed now moved a couple weeks to mid-June, I was wondering if you could tell me what has changed, and specifically what modeling you're using, because I know that you've changed that as well.
I think we talked about two things.
We've been clear that it's still June. I think when I just gave the update about where our need for the additional beds would be shifted to May from April. That first 1,000 beds that we were going to bring online, I think last week when the mayor was giving an update on our medical surge capacity.
So the what the mayor told WTOP last week, that our peak will happen in mid to late May rather than late June. What was that in reference to?
That was in reference to seeing, as the doctor just mentioned, what our need for hospitalizations will be in hospital beds. And that is actually what all of our modeling has been focused on, is making sure that we have the hospital beds to support any increase or surge in infection in our city. But you're also right, Alex, to say that these are models, they're moving targets, and we update those models each and every day. And the flattening of the curve that has happened in the district, we think is a very good thing, but we are certainly not out of the woods. What we can say with certainty is the number of infections that we are experiencing right now today is lower than we thought it would be on this day based on all the models. So we are continuing to flatten the curve in the district. We will continue to update all of our modeling to first inform our surge capacity planning, which is well underway, and hope that we see levels of infection fall in our city soon.
And Alex, the only other thing I would add to that is that we're talking about when we talk about June, we're talking about when we expect our medical surge to hit, which is different than the peak in the number of new cases, which happens earlier, and when we would expect to see our peak in terms of, unfortunately, the number of lives lost. So we're also always careful to make sure people understand that your peak in the number of new cases happens first, then your peak in the number of hospitalizations, followed by, unfortunately, the peak in the number of lives lost. So when we're looking at our models...
I think I just said that the wrong way. So what Dr. Nesbitt just said.
So in the peak, no, you said it exactly right, Mayor.
Okay.
And so the peak in, when the mayor is talking about what we expect to see in late May, some of the models that we're looking at has our number of new cases happening in late May, our peak in hospitalizations happening in mid-June, and then our peak in deaths happening later than that. So it's always, you have to account.
Because of the experience of how long people are hospitalized.
That's correct. That's correct.
And then Mayor, we got a text question from Tom Sherwood, who asked, when was the last time you were on a White House call or talked to the president or senior staff?
I think last week, and I've talked to senior staff last week. Let me just say, Tom, our approach to getting the things that we need is talking to everybody who we think can help, including members of Congress, including members of the president's task force and the president himself. I can't remember all of the White House calls I've been on. If I get out of here, I can get on another one. And I've spoken directly to the president on one of those calls in the video. I've had a phone call with the vice president. I've talked to Secretary Mnuchin's office, and of course we're doing all kinds of staff level work on supplies, but also on our money, on our $700 million. So we have been working on a lot of different angles. Spoken directly to members of the Congress, including the Speaker of the House and Leader Hoyer, and senators who are interested in making sure that our issues get the attention that they need. So we're on with a lot. I think there's a call happening now that I'm gonna get to the end of. Yes.
NBC News is reporting that the current draft of the next CARES Act once again excludes DC as a state. Are you aware of that, and your thoughts on that?
I was made aware of it this morning. We have been trying to get the issue with the district fixed as a technical amendment. I think both the White House and the Congress wanted to focus on small businesses and hospitals, I understand, are the only things included in this. That didn't stop us from continuing to push the point that we thought it could be a technical amendment. And we know that the Congress is committed in getting it fixed in the next go-around. I think it could have been handled now as a fix. It's different from the other state and local issues that need to be dealt with. It was the state issue that was dealt with the last time, and we were hoping that it would be a technical fix that could have been made this time.
Can I just ask, I see the scarf, I'm just wondering, is that your face mask that you're wearing, or is that just a scarf? Or
No, this is not a face mask, it's a scarf.
do you wear a face mask or a scarf at all?
I do.
Do you stand, I mean, we don't see you in one, I'm just wondering when you do.
I do anytime I think I can social distance 6 feet. I do if I have to go in any establishment. I do when out for essential exercise. But for the most part, I go from my home to the car to the office and back, and then anything else I'm doing right in my neighborhood. Yes.
Mayor, well, I've talked to people who go into grocery stores, and they say there'll be people in there without a mask. And it's angry. Well, what should you do if you go into a grocery store and they're allowing people in who don't have masks?
I can't really respond to an anecdotal report, Sam. People are supposed to wear masks. The grocery stores are supposed to enforce it. So if you tell me an instance where that didn't happen, then we can follow up. But I can't just respond.
Well, I mean, the checkers, in many cases, I go to Harris Teeter on Capitol Hill.
Okay, Harris Teeter on Capitol Hill is not enforcing.
Checkers are there, they don't have masks, or people that are in the store all the time. And some of my neighbors have said, that they get outraged. But
All right, we're going to send somebody to talk to them. Harris Teeter and Capitol Hill. All right, yes, sir.
Thank you, Mayor. How does your stay-at-home order apply to encampments? Where I live, I've noticed an uptick in crime. I've personally experienced it. I know, unfortunately, it is attributed to people experiencing homelessness. I observe them every day, aggressively panhandling, crowding people, crowding the sidewalk, just running amok. So why does the stay-at-home order not apply to them? And then also a more broad.
Because they don't have a home. They don't have a home. And so they do not have a home. So if you're asking me, do we continue to have an encampment strategy, the answer is yes.
Well, why aren't they allowed to
So let me
run amok
finish,
and
let me
commit
finish.
crimes?
May I finish? And so our deputy mayor for Health and Human Services continues to work with the team. We continue to have outreach workers who go out to encampments. We have newly placed hand washing stations and the like, and the police are still policing. So what we want to make sure, and we can ask the team to follow up with you, if there's an area where you think that we're failing and that's not happening, then let's talk about how we can, but to ask why a homeless person and a stay-at-home, it's kind of nonsensical.
No, I asked why are people allowed to aggressively panhandle and run amok and commit crimes. I just asked the stay-at-home order should apply for everyone. But let me pose my question more broader. The one instance I'm talking about is the entrance to a grocery store.
Okay.
Safeway, where people now have to line up outside.
Okay.
And then there's an encampment right next to them. So why does the social distancing and stay-at-home order, why are they allowed to aggressively panhandle and get in people's faces? And it's illegal under district law to have an abode on public property. It's also illegal to obstruct the sidewalk. So why does the district allow for 8 months an encampment to be at the entrance of an essential business, a grocery store, where there's a line of people outside? I have
So
reports
you
of them
are,
coughing at people,
let me
spitting
finish.
on people,
Okay, you've asked your question.
coughing on people.
Well, now I'm going to
people,
respond.
robberies,
I'm going to
assaults,
respond.
etc.
So you asked about an encampment. So you are probably aware of a protocol that we have for dealing with encampments. You are correct that camping on the street is not legal in the district. And we have developed over the course of many, many months, now years, how to enforce this protocol and have it be legal. And so we continue to work on that. So let me, I think you know that I don't believe that encampments are safe, not for the people who are experiencing homelessness or for the community. And we have worked very aggressively to find a way to get people to come inside. And so during this pandemic, we continue to have our outreach workers trying to serve people, make sure that they have what they need, but are also following the law, and we will continue to do that. So thank you for your question. And we'll have to.
If the mayor turned into staff would respond to me and take my calls, I would.
What's your name?
My name is James, 17th Street Civic Association.
Okay, thank you, James. Okay, thank you, everybody.